You're listening to the Salty Sex Cast with Mariah and friends. Minimize the fear. Expand your awareness.
Hello, babes, bitches, and badasses. It's Mariah here, your favorite salty co-host. A co-host? I'm not a co-host. I am a host. I co-host with friends. I'm so sexy, I got to share it. Right?
Yeah, you do.
The podcast is so sexy, you got to share it.
Share the wealth.
Yeah. So I have my friend Jacy Holiday here to share the wealth with all of you.
Well, hello.
So last episode, which was a quickie, everyone, if you haven't tuned in, been frequent listening, every other episode we have a quickie and then we have a long interview episode. But we talked about folks' worries about their genitalia and like anxieties and like worries it tastes bad or looks different and all these things. And so I thought it was a great segue to our lovely
surgical technologist.
Thank you. I was like, surgery something.
Coming into gender affirmation surgery.
Yeah. Which is so cool. You've talked about a few things and I'm like, it kind of gives me the willies because like surgery and like it's not the blood.
It's intense.
Like, it's just like the cutting and the things that shouldn't be open should be closed. Like,
it's a lot.
I can't even watch surgeries. Thanks, Brady, laughing at me.
I think it overwhelms a lot of people. It is. It's a very intense process. Yeah. It's not some short little surgery and then you're out. It's a very long.
Well, even short little surgeries, y'all. Watching people get stitches, I'm all.
There's not a lot of people that like my job, okay?
Okay, let me ask you, in your school and when you were going to school for it and training, do they have you go and like watch videos like your first class to make sure you can handle that?
Weed out the weak ones today.
Right? Because that would suck if you're like, yeah, I'm good with this, but you've never actually seen it and been around it and smelt it. Because they have like cauterizing and things in their room.
Yes.
And then
but
all of a sudden
watching videos are a totally different ballgame than being in that room because you do get to have the smells.
Yeah.
Have you ever smelt wet blood? It's gross.
Yeah.
Ugh.
Especially like
soggy blood.
Yeah. It's just, there's just something about this like wet metal. It's almost like
it's
wet
coppery.
dog smell. But like with a coppery, metallic, penny, like, I hate it.
Interesting.
Yeah.
Yeah. No, see, the smells alone, I'd be like, I'm out.
There's a lot of smells.
So anyone running a surgical school should subscribe to the Mariah version of the school. And first day, you walk in and it's like a Halloween game where you got to like reach inside the box.
Even make it.
You gotta reach inside the box and guess what it is.
No, because if they did it the first day, they'd lose out on all the money. They're gonna want you to go all the way through.
Oh, that's fair.
Yeah. They want you to go all the way through it. And then at the end of it, after you've paid all this money,
at least get a couple semesters paid for.
Yeah. You can't make it. That's on you.
They're
we
like,
still made all your money.
You flunked out. Here's another program you can pay hundreds of thousands of dollars to us.
We can transfer some of your credits, we guess. Maybe.
It's like because, I mean, you can take going into like being a surgical technologist and then go into like the morgue where you're, preparing bodies or being the person who's like, okay, this was the reason why they died and finding out that aspect of it. And I learned very quickly because they bring you to the autopsies. They bring you to the cadaver lab.
Okay.
I don't do cold bodies. It freaks me out. It grosses me out. But warm is fine.
Yeah.
All right. Pumping blood.
When it's cold, I'm like, ugh.
Well, and I bet the textures are weird too. I love how I'm already stimming right now because of the textures, thinking of all this.
All the goopiness.
Obviously, you have gloves on, but still, you were telling me, because we were talking about hysterectomies and all of these other things, and you were like, you want to know what a uterus feels like? And I'm all, I've never thought of it, but yes.
What does it feel like?
So do you remember back in the day when we had the like double balloon filled with sand and it was like a stress ball?
Oh, yeah.
That is what a uterus feels like to me.
Huh.
Like that sand-filled kind of stress ball. They are...
But you've only squoze one with surgical gloves on, I'm assuming.
Oh, yeah. No.
Okay.
I don't. No raw dog.
She's like rubbing it against her face. Is this velvety soft?
I mean, they are interesting. Like we had one, and it just the cervix was pretty much as big as the uterus was, so it very much had like it was just weird. It's
well,
just
if you imagine,
does the cervix have a different texture than the rest of it?
more on
firm.
It's.
Haven't you touched a cervix?
I have.
It's
but
more,
I haven't touched a uterus to compare it to.
It's more slippery in the sense of it's more like mucosal.
Okay.
Yeah.
Yeah. So interesting. But and then and about that size too, a normal uterus, right, is like a closed fist.
Mm-hmm.
Mine was not. Mine was 4 sizes the size of. That's why it got removed.
So if you remove a normal healthy uterus and you slap it out on the table, it's the size of a fist?
Yeah.
Okay.
Typically.
So like an apple?
Yeah.
Okay.
Yeah.
It's interesting to see
next
because
time
it's
you play one of those.
It's this organ that causes us
so much grief.
So many issues.
I gotta be honest with you, I wouldn't want one.
And it comes out and it's just like, that's it. I don't know why before I really got in and looked at it.
To look like the devil.
Like it take up like half.
It kind of does.
Half my abdomen.
It's got horns.
Yeah. It really does.
So for as many problems as you would expect it to cause, it should be like a whoopee cushion with thorns. Yeah.
Yes.
Mm-hmm.
But we had one where I've never seen a uterus this small without like radiation. And that was why they were taking it out. It was really small and we couldn't even use a uterine manipulator. It was so tiny. It fit in my palm.
Wow.
Like didn't even take up the full size of my palm.
So was it underdeveloped? Just never had developed, or it shrunk down?
We don't.
Well, because you're not part of that.
We don't really get
see
to
a one.
You're just part of the surgery. You're not part of the diagnosis.
Well, and a lot of doctors too, it's not their patient that they've seen forever. They're patients that have gotten sent to them and gotten put on the books like, hey, they need this surgery. So yeah, sometimes the doctors don't even have like,
that makes sense,
other than their chart and their history and hey, this needs to be done.
If I was going in and getting my uterus removed, could I opt to keep it?
No.
What?
They don't let you keep anything.
You want to send it to pathology because that's going to come back and say, hey, they have cancer.
Oh.
Yeah. You want to send it off to.
Or you finally get diagnosed with endometriosis after they take it out.
Yeah.
That's what pathology was, they're able to.
A lot of times we'll do the endometrial biopsies and all of that. Most excruciatingly painful thing I've ever had to do.
Yeah.
And they say most of the time it doesn't ever find it. It's when they get in that they finally find the endometriosis.
And that's one thing I was like, okay, I was a good candidate before getting diagnosed with. I didn't need to get biopsied while it's still in there.
Yeah.
For endo, but it was prolapsed. It was larger than it was supposed to be. I was done having kids. Take it. I was so happy. I'm like, if it wasn't so shitty, I would donate it to someone who maybe has a shittier uterus. Like, can I switch? We'll swap.
Yes.
I don't want another one in. It's amazing.
But I would gladly give it to somebody so they could implant it and they could possibly have children if they want to.
Is there anyone out there doing uterus transplants?
They have done that successfully with transgender patients who want to have kids. They've successfully had a full term pregnancy. They delivered and then they took the uterus out to avoid any issues. And
because obviously uteruses are dangerous. That's what we've learned. Like, you wouldn't want to keep it long term.
They take as much life as they give.
Yeah.
They have to be on the medication, so that they don't.
The transplant medication.
That in any kidney patient or anyone who's had a transplant has to be on so that they don't reject it.
Yeah.
So it really weakens your immune system. You don't want to be on rejection medication for your whole life.
Yeah, or have a uterus.
Yeah, no. I'm 30
That's what I'm
and I'm getting
opt out.
I'm getting rid of mine. 10 out of 10 do not recommend.
Well,
right?
so it's one of the things that you and me have talked about, Mariah, off air, is that it's tough being a woman, because it's like when I wanted to get my vasectomy, I didn't need my wife's permission. I didn't have to have like extended conversations with the doctor. And the only reason we did have extended conversations with the doctor is because he recommended it to me. He's like, why don't you talk to your wife and we'll talk again. But let's just be sure, right? But I mean, ultimately, I could have said, no, I'm going to be a playboy the rest of my life. Like, I didn't even have to tell him I was married, and I could have got a vasectomy, no problem. But you going in with like an angry, oversized uterus,
3 kids,
which is now
and
your
my
nickname.
tubes tied. Thank you. So I had already had permanent birth control. So there was no doubt that I was not ever going to use this again.
I
had
still
already
wanted to
made
fight
this.
with you.
Getting the permanent birth control was the fight.
Oh.
Fighting insurance to get my hysterectomy covered was the fight. But different story, women in insurance coverage, we can talk about that.
Oh, they'll pay for a man to get an IPP, no problem. Their dick's not working, let's fix that.
What's an IPP?
An inflatable penile prosthesis.
Oh, okay. Yep.
So we've even had insurances cover for them to get the one they wanted removed because they want more girth. And they'll pay for the one with more girth.
That makes sense.
Yeah.
It's so frustrating.
Makes perfect sense.
It's so frustrating.
So we're talking about those pieces of red tape having to go through.
Yeah.
You're 30.
Yep.
Unmarried.
No
kids.
0 kids.
And you're getting your hysterectomy in 2 weeks or a week and a half? 2 sleeps? How long is it? I know it's really
literally
close.
have this week and the weekend.
Are you going to take your uterus out and do something fun with it before you?
I
She's
did joke with my
stretch it,
doctor.
make
I
it
was
a
like, can I keep it? And he was like, no. And I was like, I'm just kidding.
So even if you're removing, like if you're removing it for like personal reasons, you still don't get to keep it.
No. I mean, you want to get it sent out, even though, like, say you've had a normal pap smear, everything's come back normal testing wise. That doesn't mean that they can't get in there and pathology finds cancer.
Well, so they sent away my little tubelets that they took during my vasectomy for testing to make sure they got the right part of the tubing.
Oh, nice. And I mean, you just...
I still wanted to keep them. Yeah.
I mean, I'm sure you could probably I've seen people who have transitioned that have like kept their uterus and put it on like in resin and then put it on like as a mantelpiece. I don't know if maybe they get it from pathology once they're done. I don't know how it works. I don't know the process to do that.
Fascinating.
But I'm sure you could possibly
So if anyone knows you've kept an organ after it's been removed, please let us know.
Send Mariah pictures.
Yes.
No,
that's my biggest thing.
I would rather have an unsolicited dick pic than someone's random petrified uterus.
I think our email is about to explode. saltysexcast@gmail.com.
That is the one thing I'm like, I want my nurse or my scrub tech to take a picture of my uterus in their hand.
Yeah.
So that I can really like see. It's hard. I mean, they tell you the measurements of everything, and it's cool to see, like, you can tell which one you ovulated off of because it's bigger. Ovary wise.
Oh wait, are they taking your ovaries?
No,
too?
they're leaving. That way I have hormones.
Yeah, because I had my hormone or my ovaries are still here.
Yeah.
I can still feel which side I ovulate on.
See, and I never thought about that. That like the one you ovulate off of is bigger in size.
So where does it go when you ovulate without a uterus?
There's little tubes that have just been pinched off.
Yeah.
So that just sits there and gets slowly reabsorbed.
It just reabsorbs.
Yeah, it just reabsorbs. I would say your tubes are not pinched off though. They are very much cauterized.
Yeah,
off.
They're closed off. It's whatever it is.
They take the whole tube up. Yeah.
Oh, interesting. Okay. Tell us how you were able to get to where you are with your hysterectomy. How were you able to get approved? What disease do you have? Just kidding.
I don't know. Okay, so I should probably have looked up like the right medical word for it. But I've had pain with sex ever since.
Vulvodynia.
No.
Oh.
There's lots of different
There are
ones.
lots of different, but that does not ring a bell. They did say it, and I was like, I need to Google
usually, yeah, that's pain around and like general pain.
And mine's not at the entrance.
Yours is up in there.
Yeah.
That achy where like it feels like someone's taking a knife and stabbing you inside and twisting it.
And like nauseous.
Yeah.
When it hits that and bleeding after. So I would have like a full-blown period with clots and everything after sex. Not all the time, but most times.
Mm-hmm.
And it just makes it not enjoyable. Like I'm constantly just worried, like, okay, well, is this going to be a time where it's super painful and I'm going to bleed afterwards? And so I just finally, working in the field, and just, I met the most amazing doctor. I got to see his bedside manner, his sterile technique, and just everything about him. I was like, this is the doctor that I want to go to. And I got to make an appointment, especially being able to see him and work for him. He was like, let's get you in. And he just made me feel so validated.
Bravo on that person, because that is usually the uphill battle. What are you making up now?
Yeah.
Oh, this is the third person I've seen today who's trying to do this. It's like, then maybe there's something fucking wrong.
Exactly. A lot of times you're just, oh, that's normal. It's fine. It's fine.
Just because it's normal doesn't mean it's okay.
Yes. And
That
like,
is
I mean,
everything.
the first time like hearing like, I can't use tampons because it's painful. It's so painful and irritating, and hearing that is not normal and just feeling so validated. And he's like, of course, you know, we can try birth control, which I am very much against hormonal birth control. And I don't want to do an IUD either. I would rather just have my normal regular cycle and not have to deal with taking any medicine or having something
Other
stuck
side effects,
inside my body that could
stroke risk,
perforate or get embedded or any of that. I just want to live a normal life and not have to have medication. And so just hearing like, okay, so you don't want that? Okay, nix that. And then he was like, we could also do pelvic floor therapy, and that a lot of times can help, but it won't take away the bleeding most likely. And so I was like, I don't want kids. I would prefer a hysterectomy. That would solve the problems. And he was like, yeah, that's going to nip it in the bud. If anything, you may still have some pain, and we could do pelvic floor therapy after.
Mm-hmm.
But most likely women who have had this problem in the past that I've worked on, as soon as they have their hysterectomy, they're good.
Yeah. After the hysterectomy is fully healed, it's like 6 months. Like, to really give your body, that's a fucking organ gone.
It's, yeah. But I mean, it's 3 little incisions.
For
which
you.
is nice. For me.
You're getting laparoscopic.
Yes. I'm not doing an open or a vaginal.
I did vaginal.
Nice.
And I don't know if it was. It was pretty rough recovery. But I knew, and I was already getting a bladder sling and other things. So there was already major...
It made more sense.
Adjustment. That it did.
Yeah.
That it did.
If they're already going to be down there, might as well.
Yeah.
So do you think that you had an easier time being able to like arrive at this decision to remove your hysterectomy because the doctor knows you and is like, oh, it's not just like a complaining patient. It's someone who's like in the field and I see her every day and she's not just a crazy lady.
I think it's just him. Yeah. I think it's these new doctors coming up. I think more and more doctors are trying to fight for women to have a say in their body. They're doing tubal ligations and the permanent birth control or hysterectomies for patients who are younger and younger who say may have some mental health issues that they know, like, I don't want to pass this on to my children. I don't want kids. And there's, okay, you have a right.
Well, one thing that's always frustrated Jamie, because Jamie never wanted kids, that's why I got a vasectomy, is that when I as a man in public, I'm like, I don't want more kids because I already have my daughter.
Everyone cheers you on.
Everyone's like, yeah, way to go, dude.
Yeah, buddy, time off.
If you get divorced a second time, you won't have child support. Way to go.
You don't want to try for that son, that boy.
Yep.
Every time I mention my hysterectomy, I get but what if you meet your soulmate?
What does that have to do with whether or not I want kids?
Then how cool I'm going to be able to spend 100% of my energy on my soulmate.
And travel and do whatever I want. I get, like, being able to have kids is an amazing thing. Us as women and our body can do that. It's fucking badass.
But it is not your
But it's
sole
not for
purpose.
me. I used to want kids really bad. I feel like me and my sister kind of switched roles. She never wanted kids. I wanted kids. She has 4 and I have none. And the older I got, the more I realized, like, one, I didn't think I wanted them. And I got like, well, if I'm constantly saying my life won't be complete until I have kids, what if I never do? And then my life never feels complete. So I need to stop basing the happiness of my life and everything around having kids. And then the older I got, the more I was just like, I'm good. I don't want kids. I think kids are amazing, but I would rather, if I get into a happy relationship, I would rather adopt a teenager.
There's so many other ways to have kids.
Yeah.
You can foster, you can adopt, you might be a stepmom at one point.
Yeah.
Who knows? And there's just so many other ways to be a parent. You don't have to biologically carry, or even if you do, you still have your ovaries. If you want to pay $100,000 for someone else to carry your kid.
Very true.
Sure. I mean, there's so many options. But for us wanting to advocate for our own needs and just being heard is amazing that someone else is hearing that for you.
It's getting there. It's getting more and more doctors are starting to finally hear women who just...
Well, so
Yeah,
one
I
thing I've
don't.
told people about my vasectomy is like I went to my doctor who had been seeing my whole life to get my vasectomy done. So it was like a clinical visit with like a family practitioner.
Okay.
The only thing I would do differently now is I would probably go back. I would still get the vasectomy, but I would probably talk to a couple of different urologists about like their experience doing vasectomies and what method they use, because apparently there's like other options out there that are kind of available.
There's so many options. I will say that because every urologist is going to do it different. That's the coolest thing I think about like the medical field is these new residents that are coming up. They're learning all the amazing techniques from their God,
like mentors?
Yeah, they're mentors. These surgeons who have been doing this for years. Some get stuck in the old way. Some have created completely new ways, and they're the only surgeons that have done it. And there's these new residents coming up that are creating their own new ways.
That's cool.
And it's getting better and better. They're learning from others' mistakes, maybe, or like, hey, this one, is 100% effective. Sometimes it grows back. So let's try this way.
Or just in like science in general, as time goes on and our sample sizes grow, we learn new things.
Yeah.
Yeah.
Definitely.
So,
it's always nice to get like new clear eyes in there. Like
super cool.
So if you've got like an old school doctor who wears a crucifix and is refusing to remove your uterus, maybe you should go like doctor shopping.
Yeah. Well, and that is one of the things I would say with a lot of people in general, not just women, but if you say you go into the ER and you have this issue and they're like, okay, well, we're going to send you over to this doctor in this specialty because they're on call. Don't just take the doctor that they're sending you to. If you find out that you need, say, a hysterectomy, you don't have to use the doctor that they're saying, here, go to this one. They were on call. They may not be the best option for you. They may not do the things that you want them to. Shop around. That is the biggest thing I can say about being in the medical field is there's some doctors that I'm just like, you know what? They're amazing doctors, but they're not for me.
Yeah.
Maybe you need someone who has a better bedside manner and they're going to be there every step of the way, which is the doctor that I found. He's literally there start to finish.
That's so cool.
He's holding your hand while you're going to sleep. He's telling you everything's going to be okay. And then he's there as soon as you wake up.
And you've seen that.
I've seen it.
Because you're there.
Yeah.
So some of the surgeries you've assisted on are pretty freaking cool.
Yes.
So sexual or gender affirming, sexual reassignment. There's a lot of different names. What do you guys call it in the field?
Oh gosh, gender reassignment, all of the above.
Any
of the terminology is
really
involved. Yeah.
Okay. Tell us some things. Fascinating just to hear, someone who really does want to, who for one has the money to be able to invest in that and be able to live the life that they've wanted. And for two, things have changed. I think
our technology has became so amazing, and they're finding more and more ways to do things differently, and even just stitching for it to dimple in a certain way or create a shadow in a certain way to give it a different look.
Wow.
Yes.
It's not just like a skin blob or something, like just
this. It's beautiful. Like using, because we do more vaginoplasties where I'm from. So that's male going to female.
Okay.
Because phalloplasty, which would be a female going to a male, takes so long. And we're just a surgical center in a sense. We're not the main hospital. So we only have people scheduled till 7 typically. We do have on-call people, but those surgeries can take anywhere to 14 hours.
Oh, gosh.
It's a long time. So we do more vaginoplasties, and it's the most amazing thing. So you see anywhere from people in their 20s to people in their 40s and 50s that are finally being able to get this surgery to feel whole. They're finally getting to show their true selves. And it's just, it's the most amazing surgery. I know other surgeries are helping too.
Yeah,
but
obviously.
the doctors, like they are the most amazing doctors I've ever seen. They take it very seriously. You will not misidentify them. You're going to treat them with the respect. You're not going to call them he when they're she. And it's just seeing that respect level of these doctors that really care. But I mean, and just seeing we take a penis and we create a vagina out of it. And it's amazing. And we use like the tip of the penis becomes the clitoris. So they have those nerve endings still to be able to come that way. So we're not taking anything away from them, but it's two teams that come in. It's urology and plastics, and it's typically recon urology. So they're the reconstructive urologists. They do a lot
Thank
of.
you for explaining all these terms. I was like, hold on.
I've gotten used to that. You've got to.
No jargon.
Yeah, no jargon. It's a lot of jargon. But so reconstructive urologists that do urethroplasties and stuff all the time work on the urethra. So they're going to build that vaginal canal in between your rectum and your prostate. And so those are muscles. The patients do have to dilate daily to keep that from trying to close in and constrict. But so they build the canal in between your rectum.
Dilate daily after the procedure?
After the procedure. Yeah. So, or I mean,
I'm like,
sex daily, that works too, whatever fun you want to take from it. But so recon urology starts first. They build that canal. They're going to, if you haven't already had an orchiectomy, which is removing your testicles, they're going to remove your testicles. They're going to remove the corpora, which is that spongy muscle tube that creates an erection.
Okay.
They're going to remove that completely. They're going to shorten the urethra down. And then the plastics is going to come in up top. They're going to remove pretty much all of it, but about like a centimeter, maybe an inch of the base of the penis. And then all the rest of the penis is getting removed. There's nothing left but that tip of the penis that's going to become the clitoris.
Really?
Yes. So you have.
I pictured it differently.
I did too.
Yeah. A lot of people picture it differently. So a lot of people think that the skin from your penis is what's going to become your vaginal canal. And it's not. We take.
Gosh, that would be so dry.
We take your scrotum. And so once recon urology gets the scrotum off, plastics comes in and they thin that graft out. And a lot of people go through like laser hair removal and stuff. That way they can try to get rid of all the hair that they can possibly. And plastics is also trying to get rid of as many follicles after. So they're going to thin that graft out. They're going to suture it around a penile mold that we have and see how much depth we have and cut it down to the right size, because recon is going to get as much depth as they can. And they'll be like, hey, this is how much we have. So they're going to take that graft. They're going to cut it to the right length. They stitch it so it's around a penile mold, and then they're going to go up top. They're going to trim off the rest of the penis skin and get rid of all of the like head that they don't need. They're going to tack that clitoris down, and recon urology has shortened the urethra, tacked that where it needs to be and gone around. And then that little centimeter to an inch left of penile skin is what that graft is going to get attached to. They're going to sew that. And what I like to call my fupa.
Yeah.
So that's the
your
fupa.
mom's pubis.
Your mom's pubis, but my fupa. They're going to then, after they attach that graft, they're going to flip that in to the vaginal canal. They're going to suture all of that down. And they staple everything. They trim down what they don't need. They try to keep as much fat as they can without it busting out, because you don't want a skinny vagina.
No,
you want a juicy padding. One. You want some padding.
Juicy. Yeah.
And so then after that, they're going to sew everything down, and they create the slit that's going to make the hood surrounding the clitoris and the vaginal opening and urethra and everything, and tack that down and try to create the lips, the inner and outer lips, and make them look as real as possible. And it's a lot of even just dimpling.
Yeah.
In certain areas, like
it lays and holds.
Yeah.
And
a lot of shadowing, and like, okay, so if we do a suture here, it creates a shadow that gives it this effect.
That is fascinating that someone took the time and to care about that for folks to have the best opportunity to be who they are.
Yeah. And there's
surgeons out there who could be like, is it medically necessary?
Yes.
No, they're fine. They can urinate. They don't need to procreate. They don't need to, and because you consider like intersex folks who
Mm-hmm.
then want to change, or maybe look different or something like that because their outer parts are different from what they want to be.
Yep.
So,
There's some people who just choose to do vulvoplasty instead of building the canal. They're just going to create the clitoris. And yeah, there will be no opening, but you'll still have the,
sensation outside.
Yeah, the appearance and
a vulva.
Yeah, a vulva
instead of a vagina.
A vagina. Yeah.
There we go.
And I mean, the phalloplasty is even amazing, and they're coming just leaps and bounds from what they were. You could see, like, because normally they take the tissue that they're going to use to create the phallus from your forearm. And so then your forearm is left very skinny, and it's just like skin to muscle to bone.
Oh.
And they're now doing like fat grafting. They'll go through, they'll lipo some around the tummy, and then they'll inject that fat to create a more smooth, streamlined look of the forearm to help.
So cool.
Yeah, help with their
I didn't know that.
Yeah. And I mean, they even, because it's kind of like they create like this little cylinder for the penis out of the forearm tissue. And then they'll go in and they'll create incisions again.
Hopefully not too little of a cylinder.
Oh, no.
Sorry.
That is cool that you kind of get to like design. And I mean, I'm sure depending on how much they can take too, how different sizes, different people.
They're not lacking. They are very decent. Most people do. Most dicks are tattooed. Most phalluses that we create are tattooed. So they go through.
I would get it tattooed before. Like, I'd be like, how do I put this drawing on so that when you get it put together, it'll be right?
You outline what they need to do. like a little craft project.
There you go. The dotted line.
Yeah.
Cut here.
Yeah. But I mean, even just the incision they make to make the tip of the penis to create the meatus that relate the glands.
Yeah.
Yeah. We'll do a glandsplasty, and we make these incisions, and then we kind of bunch it up and pull a little tighter to create those glands to make it look like a circumcised penis, which is really amazing. But there's also people who choose to just like, they take the testosterone, their clitoris enlarges, and we'll do a release to kind of bring it further out. And that's all they choose to do.
Yeah.
As well as closing up their vaginal canal.
Spectrum of opportunity, different choices versus it's this or nothing.
What works for you?
Yeah.
And then I mean,
everybody's different.
We do IPPs as well for, phalloplasties. It's inflatable penile prosthesis.
Yeah, you already said that.
I did, but I did not say it for the camera. For this, right?
I can't remember.
We might not have been recording.
We might not have been recording yet.
See, but Jacy knows her shit. She knows what's going on. Yeah. She's gonna remember if there was a tool anywhere. Sponge left it. I'm just kidding.
Counts are super important. But yeah, so we can take someone who has, no way to get an erection, and we can make them get an erection, which is really cool. And we'll just put in one little testicular implant, and then the part that inflates the penile prosthesis, it's like a little bulb. And that'll be
like
the other testicle. Yeah.
Do you pump it up, or do you just push it up? You just keep pumping it up?
Yep.
And then to let it go, you just
hold. There's a little button on it, and
there really is.
There's a release valve.
Yeah. That is so
this
cool.
It's almost like old school technology, right? Like they've been giving penile implant pumps for the people with diabetes have been using them for a long time, right?
Oh, I don't know about that. I haven't dealt with a lot of diabetes.
Certain types of diabetes, I guess, can give you erectile dysfunction. So, like, that's like a move that people with diabetes do is they go to the pump. Yeah.
Yeah.
I mean, a lot of men do it for a lot of different reasons. And I mean, say you have an erection for too long and you kill off that tissue.
Priapism.
Yep. So, I mean, if you go in time, we can get rid of that blood and get rid of that erection.
But that's why anything more than 4 hours, people.
Yes.
You rush yourself to the emergency room, you can kill your dick.
Yes. We had someone go like 7 days, I want to say. And it was like black and blue. That muscle has just atrophied. You're never going to be able to use it again. So then they'll come in for an IPP later on. Once they're healed. Yeah.
Once they're healed.
I mean, we even have AUSs, which are artificial urinary sphincters, that people who have issues with leaking
Mm-hmm.
and incontinence. It goes around your urethra and you blow it up just like you would an IPP. And then when you feel that sensation like you need to go, you release it. You can go and then you pump it back up.
Pinches it off for you.
Yeah.
Hey, I needed that, but oh wait, I got a sling, so pretty much.
They
I
don't
got help.
do it for women very often because I mean having that
women.
bulb. I mean, would
And
you
having,
want
where
that
am I
in
gonna
your
pump
lip?
that up?
They would put it
What
in your
if
lip.
I like had a lip and then I'm just like
I think you should have your custom pump installed in your nipple.
just a little.
So you can
You'd need some long tubing for that.
Yeah.
Oh,
Yeah.
that gives me the willies. Anything foreign in your body, like it's so
like
funny.
tubing.
Not anything
Tubing.
foreign.
Really long
I mean,
tubing.
let's be honest.
Anything surgically in your body. I was watching our other friend practice suture.
Oh, it's so fun.
And I was like, what are you doing down there? And she was like, well, you got to get the underlayer, which I don't know the name for. And I was like, what? And I was like, I thought you just sewed up the top.
No, they'll
And
do a
she's like,
deep
No.
dermal layer.
That's it. And I was
Yeah.
like, ugh. Like I'm turning green and it's a fake little silicone thing that she's practicing on. And I'm like, just thinking of all of those layers of something that shouldn't be on my body,
Yeah.
then someone cutting it open. I don't know if I could ever actually watch like a scalpel glide across the skin like that.
It's so cool.
It's the skin pieces of it that
Yeah.
it's not the blood. It's not the blood. And the smells would get me absolutely. So
Oh, yeah.
thank you for doing that work for
Of
those
course.
people, because obviously not all of us are built for it.
I absolutely love it. It's like,
Oh yeah, you tell us all the time. You're like, guess what I just assisted on? Guess what happened?
it's
Like it's
so
so neat.
cool. Like knowing that you can live without like the bridge of your pubic bone and be just fine. You don't need anything in between. We can literally cut out just that little part of your pubic bone and you'll walk just fine.
Huh.
It's so cool. I love surgery and medicine.
I'd want a replacement part. I'd want to be able to feel that part.
You like that?
Yeah.
You don't want it
I
just
love how you
hollow.
just kind of
Yeah.
hump the air over there.
I don't want it to sound like a drum when I'm masturbating.
hollow.
I don't know if that would actually
Oh.
happen, but I mean, we'd have to probably do I ask that all the time with the vaginoplasties because we're doing the vaginal canal in
Mhm.
between the rectum and
Yeah.
the prostate. So I'm like, I wonder if they get more stimulation on their prostate
Yeah,
And
because there's
so if
something
they
right
have-
next to it now.
if they have a better sex life from it, you know?
Fascinating.
Very fascinating.
Oh, so amazing that's. Is there any time that folks are denying? Well, you're probably not even part of that. You're there once it's done and it's ready to go.
Yeah.
The approval's there.
You have told us don't smoke weed before your surgery.
Yeah, it messes with anesthesia.
Messes with anesthesia.
Same with when
you
they're
can eat
asking
weed
you.
though. I can eat weed,
I don't know, probably.
but it's the smoking because it's the thicker smoke inside my lungs, right?
It makes you eat through your anesthesia quicker.
Interesting.
Yeah,
so
you metabolize it faster.
Mm.
Same with redheads. Like if
I know
them
redheads for
asking
sure.
Your hair color is a big deal. If you are a natural redhead, you need to tell them because it's going to take a lot to get you under and a lot to keep you under.
What if I just said, "Hey, top me off like if I were a redhead because I want to be the
No.
super drugged."
I think it's anesthesia is one of those things they don't really like know why it works.
Well,
So
and
they're
it's
like-
not something you fuck around.
Yeah.
Like
Well,
you can go.
The only thing that would do giving you like like bumping you up and giving you more is it just takes you longer to wake up. So you're stuck in the OR with us, like waiting around for the next surgery because we have to wait for you to wake up to be able to transfer you to PACU.
Mm-hmm.
So giving you more just makes your wake up longer.
Gotcha.
Yeah.
Mm.
You want more of like the good stuff, like the fentanyl and stuff like that, the
Yeah.
pain. I
Eh,
mean, they can also give you caffeine if you have like hard times waking up. They can,
Interesting.
yeah.
Well, after my boob job, they were like,
Which is why it makes me giggle when you're like, ooh, anything
foreign
foreign going in the
objects.
body that's surgically put in there.
it really
Those
freaks
are
me out.
foreign.
It's because if I could feel them, it would totally freak me out. But that they're under the muscle, it's not as bad, and they're soft. Like a hard implant, like some of those
The
birth
implants
controls
aren't hard though. That's the thing. It's your capsule. It's how you heal. So
Oh,
your body
yeah.
will create that
Yeah.
capsule around the implant. And I've seen some that are so tough.
Yeah, it's like a rock hard,
leather,
and you see,
and that's
you
what
can
creates
see
a rock
some,
hard.
yeah. But like hard things that you can feel under the skin that are not supposed to be there, like bones, whatever. Everybody has that. But what's the one? It's not Ishar.
So
what is
you
it?
would be freaked out though if you realize like you can
Mhm.
feel when you move your wrist, your bone literally rotates.
Oh
under.
yeah, like I said,
it's
bones are not a thing. Like it's like, okay, there's a little something that shouldn't be, like someone.
I used to when I was a kid, I got shot in the forehead with a pellet gun,
you could feel it.
and the pellet was stuck in there for quite some time. And I used to put refrigerator magnets on it, and I wish you'd have been around for that.
Oh, gross.
That would have been an intriguing moment for you to go get an MRI. It would have sucked it right out.
Well, we tried. So my dad, when I first got shot, was like, "Well, we got to get it out of there." So we went to the hardware store and bought like a magnet that's meant for like, picking up tools, and all it did was hurt a lot.
Oh,
Yeah.
I wonder if it shifted just enough from the wound.
Yeah, you should have made sure it was right at the opening and then tried to get it.
Eventually, my mom's a nurse, and some doctors talked her into taking it out herself.
Nice.
Yeah.
I mean, they will do
Scalpel.
that. Yeah.
Yep.
My mom was a nurse, and that was like hemorrhaging after surgery, and they're like, "Oh, Kim, you know what to do if you bring her in. They're just going to be really rough with her."
Mm.
So she did what she could at home.
Yep.
Still
Crazy.
here, so
Still
they're the worst
here.
patients. So
Nurses are the worst patients.
the
Yeah.
worst
Awful.
patients. They
Yeah.
don't listen.
Yep.
I know better. Don't tell me what to do.
I can take care of myself.
Right.
Shush, doctor. I've seen your work.
So some of the healing and other things. So you were saying,
Oh yeah, they have to dilate daily.
Mhm.
That way they can, because that, I mean, that's
those muscles
want to go back.
Yeah, and close that vaginal canal that you just had made.
It won't necessarily close completely, but it will.
Yeah,
It'll just be
like-
super small and
Yeah, probably maybe painful.
probably very
uncomfortable.
painful. Yeah.
Yep.
So I mean, you can choose which way you want to dilate. We give you dilators. I'm sure you're paying for it, but
Yeah.
when we have you leave the OR, you have 4 sizes in dilators. So smallest to the biggest. And then so you can choose to do that, or if you're very sexually active and you have your partner, you're dilating that way.
So brand new vaginal canal,
Mhm.
super sore, super tender. There was a whole lot of things happening.
Still got stitches.
And then you still have to dilate daily after that.
Yeah, I think they'll give you, so they
I'm
have,
sure there's maybe some numbing cream or something, like lube numbing. No?
I wouldn't recommend
Oh,
putting
well.
that in a fresh wound.
Oh my God.
Yeah.
My vag is like puckering right now.
You'd think maybe when you first get sent, I would think, I don't know, I'm not a doctor.
That it would be packed.
I would think you would just
They
have
do.
something.
They pack it
Okay.
as
Yeah.
soon as they're done with surgery. And
that's good for
I'm
a
pretty
couple
sure
days?
they leave it for at least a day.
Yeah.
Yeah.
And then
'Cause
after that,
I was even packed after my hysterectomy. Well, I had a vaginal hysterectomy.
they don't do that anymore.
Oh, well, yeah.
Not that I've seen, at least.
I was complaining of
'Cause
so
we-
much pain.
Oh, okay.
I don't not Lortab. No, not Lortab.
Oxycontin.
No, the other. I don't know.
Hydrocodone.
Lotran.
Morphine. I don't do well on morphine. I still feel everything.
The fuck were you getting morphine for after that?
After my hysterectomy?
Yeah.
Yeah, and I just stay overnight in the hospital. And I've heard laparoscopic, it's an in-out thing.
We have to stay for 26 hours, I believe it is.
Okay.
Mhm.
Yeah. Well, and then you say you have to do a few things. You have to walk on your own. You have to pee on your own. There's a few other things that you have to do before they leave.
I can leave early. I don't have to stay the 20
because y'all know
hours.
the people. Because you're a shitty
You're a
patient.
fucking
And
nurse.
you know what to do.
No, it's just those are like, if it takes all that time, then it takes all that time. But if you can take medicine orally to control your pain, if you can eat and drink without vomiting, if you can urinate yourself, and if you can walk without too much assistance, why not let you leave?
Yeah.
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 You know that after a colonoscopy, they won't let you leave till you fart.
Oh, that's fun.
A lot of surgeries are that way. They want you to at least have a bowel movement or fart.
Make sure there's nothing obstructed or
Yeah.
anything. Oh, that'd be the worst thing.
But
to
I
get you in
think
there.
like the biggest difference from like a vaginal to a laparoscopic is they're just laparoscopically inside doing everything.
Yeah.
And vaginal, they're just down below doing everything. But laparoscopic, they still pull my uterus out through my vaginal canal. So
yeah. And so morphine didn't touch the pain. I was in so much pain and I was just so nauseous. And I was like, I do not want to flex my muscles right now to vomit. And so I started panicking and crying. And she was like, and so the nurse was thinking I was in so much pain because of the packing. And she was like, yes, this doctor's kind of known to overpack. I was like, please don't tell me that when I'm fucking stitched up. And I'm imagining hamburger canal down there. I have no clue what it looks like because obviously I don't assist on anything.
yeah.
And
now
so
they've just loaded you up with gauze, so it's going to be all flappy when it's
I have
done.
never seen them, and not all flappy. Good Lord, you
Rude.
men. God.
rude. But I was just kind of starting to freak
wasn't
out,
saying
and I
that
was
it
in my
is.
own.
I was just saying I can see waking up from that surgery being like, God, I hope they didn't ruin it.
Yeah.
Oh yeah.
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 And I'm still upset that it was a male doctor because I'm pretty sure he made me like smaller on purpose because it was so painful to have sex for like 6 months. And then one time it just kind of was like a little bit better. And I was like, okay, I don't know if there was like scar tissue that finally got moved. I have no clue. But so I was freaking out and she was like, well, let me change your meds and I'll take the packing out. Let's give it 2 hours. And I was like, can we just change the meds now? And she's like, you sure? This is really what we suggest. And I was like, give me the stupid ibuprofen. Like, I would rather have that, whatever that name is. It still goes through your IV, but it's ibuprofen line of meds. Guys, I don't know this stuff.
I don't deal with meds. Don't ask me.
Just kidding. A hospital druggie.
I just do Lido and stuff
Right.
on the back table. So
Yeah. So, and then finally she came back and started pulling out the packing and just watching that gauze get pulled out. And you can kind of feel it. And I was just like, talk about feeling foreign. And I was like it was like 30 feet. I felt like, and she just kept pulling it out.
I'm sure they used to do that to like try to prevent bleeding. It's a form of hemostasis to put that pressure on it.
And because she took it out so soon, I ended up having postoperative hematoma, bled, had to go back to the ER. It was awful. So keep your packing in.
From what I've seen, they don't do packing anymore. So I don't know.
Okay.
Maybe just
I
new
had a very old
techniques.
school doctor too.
Yeah.
Who liked to pack, apparently. He was a big Packers fan.
He made a joke at my final appointment because it's like 8 weeks bed rest, like no sex, not like bed rest, sex rest. I want to say it was 8 weeks, and like after my kids, I was like, okay, that's cute. Like 6 weeks, I'm not waiting that long. I had easier labors. I was not gonna push it at all. It was like 8 weeks. I had my checkup. He didn't even like physically check me. He was just sitting in his office. He's like, you feel good? You can do that? Cool. And just left me out. And he was like, is your husband waiting in the parking lot, just waiting for the time to fuck you? Like that's it. I'm not just a hole to be fucked. Thank you very much. I am just so happy I don't have a diseased uterus giving me all this pain and grief. I just did not like how he said that.
That's
like, is your husband in the parking lot just counting down?
Shop around for your doctor.
Oh, I shopped around to someone to finally listen to me.
Yeah.
I was like, okay, you're going to take it? Yeah, let's do this. I don't give a shit how stupid you are, like, and annoying and rude.
Yeah.
But, yeah.
You can have it all, though.
You can if you're patient and shop around. I'm not patient.
Or if you just happen to work in the field and you just see one. Because I don't know if I would have ever ran across him.
Yeah.
Had I not. Because, I mean, I live in Ogden and I work up in Salt Lake City. So I doubt I would have been like, oh, let me drive all the way to Salt Lake City or Sugar House to go see this doctor.
So
I've
cool.
never known. Yeah.
So if anyone's looking for a doctor, keep shopping around the Sugar House area.
Yeah, I would. I don't know if I could name drop. I don't know if you'd like that.
I would hesitate to do that too, just as out of respect as well. But
he is definitely amazing.
That's so awesome. I'm so excited for you.
4.9 stars rating for a doctor.
That's really cool.
That's insane.
On like Yelp?
No, on his because the U has you can search through the doctors and it'll show you their ratings. Every doctor's going to have it. Google, Yelp, whatever. 4.9.
That's awesome.
Yeah.
Nice.
Super rare.
Out of curiosity, is insurance covering it?
Yes.
fully?
Fully.
Or
So I pay $167 out of pocket.
For your copay, just like a normal copay. Yeah.
like $167?
Yeah.
That's pretty close to what I paid for my vasectomy.
Oh, that's awesome.
Yeah.
I forked over several grand. So
But everything else was covered by the insurance, and it was. I remember like the doctor even made a comment. And he was like, "It's a good thing your wife's not getting her tubes tied because they don't cover all of this."
they don't. It's
Yeah.
so dumb.
I was like blown away because I was like, "Isn't it like? Don't they make women's insurance more expensive because they have the chance of gestation? Like,
I don't know how that works.
you would think they'd be willing to pay to
Yeah.
like not make you a birth risk."
Yeah, because
Yeah.
then you're cheaper because then we're not having to take care of. I don't know.
Pregnancies.
I don't know, you guys.
One
Yeah.
of these days, women's health care will be the same as men.
Also, why do I need different insurance for my eyes? That seems weird.
Well, and some health insurance do cover your eyes.
Oh,
Yeah.
Every time I went to the eye doctor, I would give him my medical
I have a
insurance
different card
and
for
my
it.
and my eye insurance. And then when I got my LASIK, I used both for that too. Anyway, it really just depends.
I think my dental is a
Yeah,
separate
corporate.
card.
Yeah,
Why is that?
but my orthodontist accepts both dental insurance and our health insurance.
Probably
It
'cause he
depends
does,
on
like,
your
The type of surgery he's doing, he
Yeah.
can classify it as something different.
yeah,
Yeah.
like interventions for health.
Sure.
Snoring or something, and let me give you a mouth guard. That's still orthodontia.
You know
But
what
that's a
I have
health risk.
heard with snoring? You need to tape your mouth.
Tape your mouth.
Mm-hmm.
What?
Tape it close so that you're not breathing through your mouth,
Yeah.
and it forces you to breathe through your nose, and it helps a lot with like opening up.
But
and
then how would I
giving you-
drool on my pillow?
Oh,
Well, you
right,
know
I'm
what
a
the
drooler.
best solution to snoring is?
What?
You just get the heaviest, thickest pillow in your house.
Shove it over their face.
Until they stop. I am over it. You guys, we're having a real rough time right now.
Yeah.
Because injuries.
Tape his mouth shut.
With the size of his nostrils, you'd think he was a nose breather, but no. And yeah, we're working on
So
it. There's other
I have
things.
heard recently of like an over the counter type of a mouth guard thing.
We've tried it all.
yeah.
I appreciate it. Thanks, though.
Okay. I was just I don't know. I've never heard of it. So
No, well,
but I thought about it because recently Jamie has
I've
made a
lost
comment.
some sleep.
Yeah.
It's okay. Just a little.
Oh God! See,
I'm
I used
at
to
the point
love
I'm
when my
going to
person snored.
invest in like a cot for my office and just sleep in my office. That's the point I'm at. I'm like, I can't. Yeah. Anyway.
That's how you know you're in a happy marriage. Though it bugs you.
Yeah.
I was in a bad relationship, and I knew I was safe when I heard the snoring because he was asleep.
Oh, Jacy.
That just broke my heart, girl.
Girl, I mean, it happens, but it was like I was just like, oh, okay, it's over for the day. I'm safe.
Mm-hmm.
I can sleep now.
See, I wait to hear Jamie snore and then I go eat snacks. As soon as I know she's asleep, I can get in all the
dietitian is asleep.
Yeah, the dietitian's asleep. I can get into all the good stuff.
Heck yeah.
I did
love
bring
that.
cookies for you because I'm domestic AF.
Yeah.
Ooh.
I was like, I love you. I did use some expired ingredients. They're delicious. I've eaten them. I'm fine. Okay. But the chips I used, because I made butterscotch oatmeal cookies, which are
Ooh.
amazing. They're my fave. I brought you some too.
Thanks. That sounds really good.
And the chips were like expired in 2019. I was like, it's been like 5 years since I've made cookies. Like it's been a minute. So
COVID's kind of fucked everything up still.
Yeah.
Yeah.
it's not really COVID.
Those are COVID. You
And
just gave us COVID
the more
chips.
you
bought those
the
back
more
in
you
March.
keep those treats and make the cookies, the more you eat them. Like
Yeah.
let's be honest.
It was just I just like I'd rather run up to the store and go buy them. Someone else
You
makes
don't even
them
have to
better
run
than
to the store. You can just have
Uber
them
Eats.
Ubered.
Yeah.
Yeah.
Can you just leave them on the porch? Actually, better yet, open the door and
Shove
just
'em
slide
in.
them
Throw
in.
'em. Throw them down the hallway to me.
Like a little birdie.
Yeah.
Just feed me. But don't chew it up and spit it out in my mouth first. Thanks. I'll pass.
No, thank you.
No surgeries, no chewed up chips. Gotcha.
Yeah.
Or chewed up cookies.
Or anything chewed up. What are you looking forward to with your uterus gone, being a hister sister with me?
Oh God, sister. I'm just excited to no longer have to worry about pain or bleeding.
Mm-hmm.
Like for sex to legit be fun
Yeah.
Not have to worry if this is going to cause me any pain.
Yeah.
And then I mean, come on, no more periods.
You get to clear out all your purses, all your glove compartments, all your backpacks.
Yes.
You know, when you pack for vacation, you're not like, hey, I'm going to need this product and that product and maybe this because what if it's a heavy flow? And then maybe that because what if I'm just spatting?
Yeah. No.
You don't keep them on hand in case one of your friends comes running up?
Nope.
No.
Okay, fuck you.
SOL.
Fuck you and your uterus.
I'm going to save
I'm pretty much a
all
guy
that
friend at this
money.
point now.
Yeah.
Don't even.
Save all that money.
I will go buy them for you.
Yeah.
I do actually.
I don't need them.
I kept all of my old stuff or like my stuff because I have also children too. Like, you know, my daughter's going to be there in just a little bit. It's not like a tampon
Check
expires.
the expiration date.
You sure? I feel like of all the things on the grocery aisle shelves, those ones should probably expire.
They do.
Yeah.
I'm pretty sure they have an expiration date.
Really? Maybe I should go look
I've
at that.
I've seen Q-tips with expiration dates.
How are you storing your Q-tips?
I don't store Q-tips, but
Oh.
I've seen them with expiration dates.
Hmm.
But like, you know how like a box of Band-Aids said like, they say sterile on it?
Yeah.
It can only be considered sterile for so long.
Yeah.
Okay.
And so that's what the
yeah.
expiration...
And you don't want to
Well,
give her a
needs-
busted ass
Tampon.
Yeah.
tampon. to
Plus in the
put-
future, they'll probably just transport that stuff out with like a laser beam anyways.
Oh,
right.
God.
They should be working on that stuff.
I don't know if I would actually.
Cotton won't be available.
You know
You'll have to
what?
use
Or
a
may-
Diva cup.
Or
Ugh.
free bleed is the way to be.
No. That just. It sounds like a lot of laundry
It
and a lot of
sounds like
peroxide.
soggy blood that stinks. Like, what if it's like a humid day?
Well,
and-
I mean, not to mention, I mean, how many times have you like been going to sleep at night and you've leaked? And
Oh,
then
yeah.
and then you have to not only clean your sheets and get the blood out, but then your
It's like
mattress
every
is stained.
single
So you
period.
need to get so you need to, clean your mattress. It's just a pain, and the freedom from that.
I
is
get
gonna
to
be
wear
so
white
beautiful.
pants.
Dude,
I get to
white
own.
underwear.
Yeah, that too.
I won't ever
I
have
like
to-
black panties.
I
but
mean,
okay.
yeah, I do, but just the fact of like, if you ever like,
have
find a cute little
choices.
yeah, you have choices. Like if it's a light color, I have like certain one like pink and light blue and stuff that I'm
Mhm.
like, ooh, I'll wait until I know I'm not gonna start.
I'll never
Yeah.
wear white underwear again, no matter if I get my period or
Your
not.
shit
It doesn't
stains.
matter. Yeah. No, it's just
you
like
would just wipe your ass good enough, Bray, and be okay.
Hey, he dude wipes.
I do dude wipe. Yeah, I'm a dude wiper.
I just hate the fact that they literally had to put dude on some fucking wipes to make men feel comfortable to
Well,
use them.
so I was using them before that. I was buying baby wipes, and then the only reason I'm hooked on dude wipes is because I don't like the scented baby wipes. It it's funky. I'm not a fan of the scented stuff.
They have
Well,
unscented.
And I
Yeah.
think Dude Wipe is the only brand I found so far that does the single pack. So when you're on the go,
Yeah.
you
it's
can
so
just
nice
grab
to
a dude wipe single
pop
pack.
it in your pocket. Yeah.
What about a bidet? Have you thought about that?
I during COVID, I would like basically just jump in the shower.
When all the toilet paper was gone.
You know,
Yeah.
When you were rationing
Yeah.
But I
squares.
mean, you could get a bidet and then you don't have to use wipes anymore. Because I
Yeah.
mean, I just feel
I'm
like
not anti bidet. I just have not. I don't
yeah.
haven't thought about.
I want the
but-
super fancy
I think-
heated one.
I think
the
Jamie
vibrates.
said no.
that vibrates.
Teen tingles.
Well, I mean, you can get the ones on there. She doesn't have to use it, but it
Yeah.
would be there for you to use. My dad did the tushy one, randomly got it on my front porch and was like, what is this? And then all the siblings had gotten one. So we decided it was a dad present. Okay, dad sent it.
That's funny.
Yeah.
Love
So
it.
it's by Tushy and it just screws on.
I'm a big
Yeah.
fan. I'm a big fan of them. There's a reality TV show where this lady goes around. She's a real estate agent that sells homes inside nudist resorts.
Hmm.
And like the first thing all the naked people look for when they go in the
A
bathroom is,
bidet.
does this one have a bidet? Because I'm going to be sitting on a lot of things. So
'Cause
I
they
never
don't have
thought
a
of-
Salty Sex Cast branded taint towel that you can get on
yeah,
saltysexcast.com. You go hit that little merch button. You can get a shirt like this or a
like
shirt like
this.
that or a couple other shirts that we have in the room that we took photos of earlier. We have shirts. We have a branded taint towel, which is really just a towel, but you can use it for your taint if you are a nudist and you want to sit down on things. It's beautiful and lovely.
or you have a taint that you want to clean.
that too, Brady.
Yeah.
That too.
Yeah, let's not limit our market here.
Yeah. And then I'm going to ask everyone who's listening to please like, share, subscribe, and give us a motherfucking rating if you can.
Yeah.
Like that just lights up my day.
All right.
It really does. Like, it's the only time Mariah calls me anymore. She's like, have you read this review?
Aww.
So, check it out.
So, thank you. Love you all. See you next week.
Thanks for having me. Super fun.
Bye.
Thank you for listening to the Salty Sex Cast. Ready for round 2? Find us on Facebook.